Hello, I want to share with you all an update on the status of healthcare in Chattanooga that I presented during the Chattanooga Chamber's virtual expo last week. I'll provide a look back at a year that redefined our lives, share insights into the profound impact the pandemic has made on the health of the community, and peer into the future of healthcare in Chattanooga. At this time last year, our world was at the precipice of the pandemic, and our lives were being disrupted in ways we could not have anticipated. On March 13, 2020, our community joined the world in a fight against a disease we knew little about, as the first COVID patient was diagnosed. This pandemic has made the suffering of the most vulnerable people, the elderly, the sick, the poor and unemployed, even deeper. As of May 5th, over 44,000 people in Hamilton County have been diagnosed with COVID, and 98% have recovered. 491 people have died. From October through December, COVID hospitalizations in Hamilton County and surrounding counties were on a steady upward trajectory. We experienced a peak in hospitalizations at the end of December with 362 inpatients in our region's 6 health systems and approximately 23% of those patients needing intensive care. Since that high point, hospitalizations declined to 70 inpatients on March 11th. As of May 4th, there are 85 inpatients in our region's health systems, a 20% increase from our March low. This slight increase is largely attributed to COVID fatigue, as we are all weary of being isolated from our families, and many people have relaxed their personal vigilance around public masking and large social gatherings. We are hoping that our community will not experience a third wave before we have herd immunity provided through vaccinations. We implore the community to remain laser-focused on reducing the risk for a resurgence that would be a devastating setback to our economy and our mental well-being by continuing to mask in public, avoid large gatherings with people who are not related to you, and get vaccinated. Throughout the pandemic, the Chattanooga Area Health Systems, Hamilton County, and the City of Chattanooga leadership worked collaboratively together to model and plan for patient volume, worked together to procure needed resources and personnel, shared creative ideas and analytic tools, and shared rationale for difficult decisions. As a result, we now have a sophisticated playbook to aid our response to any future community health crisis. The collaborative formed with CHI Memorial, Erlanger Health System, Park Ridge Health System, Nova Cleveland, Hamilton Medical Center, Ray Medical Center, the county, and the city has lasting benefits beyond this pandemic. An unfortunate tragedy of this pandemic, though, is the detrimental long-term effects on patient health caused by prolonged care avoidance. As the pandemic intensified, and even today, many people refused or delayed care for known or undiagnosed illnesses for fear of contracting COVID while at the doctor's office or at the hospital. While you, our extraordinary physicians and clinical leaders, practiced extreme safety measures and redesigned approaches to care to ensure safe access, heartbreaking stories of advanced illness and disease are now playing out across our community. Women who canceled mammography appointments early in the pandemic are now being diagnosed with advanced breast cancer. Men who ignored signs of hypertension or did not want to be seen by doctors for follow-up care have experienced major heart attacks and strokes. Across our community, the life-saving screenings and annual wellness checks were postponed by patients, with many now experiencing devastating consequences. At CHI Memorial, we have intensified our focus on the prevention of premature deaths. One example is our initiative to bring two of the most important screening programs, lung and breast cancer, to where people live and work. We recently added a third mobile mammography coach to our fleet of outreach coaches. Our newest mobile mammography coach offers 3D tomosynthesis as well as cervical cancer screenings and serves a 24-county region in Tennessee and 5 counties in Georgia. Our new Breathe Easy mobile lung screening coach offers the most advanced low-dose CT technology to detect lung cancer at its earliest stages and serves 14 counties in Tennessee and 8 in Georgia. These coaches represent a significant investment in eliminating barriers to life-saving screening programs. We are also deeply invested in helping to ensure that the most vulnerable members of our community have access to the COVID vaccine. In partnership with the Community Foundation of Greater Chattanooga, Whiteside Faith Manor, Olivet Baptist Church, and the Hamilton County and Catoosa County Health Departments, our teams have administered directly or assisted with vaccination fairs of more than 62,000 healthcare workers and community members. Our CHI Memorial Medical Group also offers COVID vaccinations to their patients. Our efforts, along with the other health systems, pharmacies, nursing homes, and others, are doing our part to stop the spread of COVID. I wish to thank all of the associates who volunteered at these community clinics. We also owe our appreciation to our county health departments. They have truly made a difference throughout this pandemic with testing, contact tracing, providing education, data tracking, and now really carrying the heavy load of vaccinating our residents. They, along with numerous volunteers, have made a significant difference in the race between the vaccine and the virus. Winning this race will require a substantial portion of our population to be immune. Experts say that vaccinations of roughly 50 to 70% of our community is the most important way we can achieve herd immunity and resume our normal lives. As of May 5th, approximately 31% of eligible Hamilton County have been fully vaccinated, and 24.9% of Catoosa County residents have received at least one dose. Among our associates, over 60% have been vaccinated, and nearly 90% of all physicians. Thank you to those who accepted the vaccine. As more data about vaccine safety emerges, we encourage all associates to become vaccinated. Our foremost goal from the beginning of this pandemic has been to protect our caregivers. The vaccine gives us another layer of protection to offer you. So make an appointment with Employee Health to receive either the Moderna or the J&J vaccine. By taking the vaccine, not only are you protecting yourself, but you are partaking in a sacred moment that is a critical first step in saving the lives of our family members and our neighbors. COVID has brought to light the opportunities and challenges for the future of healthcare in a post-pandemic world. Throughout the pandemic, we have witnessed unprecedented examples of courage and kindness demonstrated by our healthcare workers who show up every day to do whatever it takes to battle this illness. We all have a deeper appreciation for you, our physicians, nurses, and frontline caregivers. As the pandemic stretches into its 14th month, we see an urgency around retaining our key talent in light of the emotional and physical exhaustion many are experiencing, and to attract healthcare talent to meet our increasing need. To this end, our healthcare community is working with the Chamber and with secondary and higher education to recruit new entrants to nursing and other healthcare professions while ensuring our clinical teams are supported by tactics that ensure their safety, their well-being, and provide meaningful outlets to foster personal growth and development. The pandemic is also responsible for breathing life into the biggest surge in healthcare consumerism in our history. As we recognize the need to limit in-person visits in the early months of the pandemic, health systems across the country and here locally, we rapidly adapted to provide telehealth services. According to a report from S&P Global, telehealth patient volume increased 3,000 to 4,000%, and global venture capital funding for digital health companies set a record at $6.3 billion during the first half of 2020. CHI Memorial Health System provides telehealth visits with our primary care and specialty care physicians and bedside telemedicine consults for neurology and psychiatry in the hospital, with plans to expand to other specialties in the future. We have also expanded our geriatric medicine program by offering telemedicine at Alexian Village. This is a promising and growing area of medicine that holds great hope for extending care to rural areas with access to those difficult to recruit medical specialties. Consumers accustomed to healthcare delivered at their convenience now expect more from their healthcare provider. Mobile medical apps that provide artificial intelligence-generated triage, provide crowdsourced and trusted healthcare content, and provide vital sign and device monitoring will be the new norm and will be expected by consumers prior to talking to a physician. As health systems, we are compelled to advance new partnerships that will provide the intellectual and financial capital to build the direct-to-consumer ecosystem of the future. Post-pandemic will also be a transformational time in the advancement of medical technology. Artificial intelligence will provide physicians with access to decision aids to speed diagnosis from wherever they are, at home, the hospital, or even while traveling. 3D printing will provide physicians with customizable implants for joint replacement surgery, and innovative interventional techniques will reduce the need for invasive surgeries. Our challenge as a healthcare community will be to balance the financial recovery process with the right advancements that provide great healthcare value to our community. As a faith-based organization created in the image of Christ and inspired by the Sisters of Charity of Nazareth, CHI Memorial pledges to relentlessly pursue the highest quality, safest, and most compassionate care for you, your employees, and family members. We are grateful to our community for their prayers, kind letters of encouragement, and for their ongoing donations for our teams on the front lines. Our nurses, physicians, and clinicians feel their love and support each day. We are also grateful to our partners throughout this pandemic: Erlanger Health System, Park Ridge Health System, Tenova, Hamilton, and Ray Medical Centers, the Chattanooga-Hamilton County Medical Society, our elected county and city officials, and local business leaders. We cannot fully express how we have appreciated the collective collaboration. It's been said that relationships don't last because of the good times. They last because the bad times were handled with care and love. These leaders have demonstrated a deep caring and love for this community, and strong bonds were forged that will carry us through this pandemic and beyond. In closing, I want to especially thank each of our faithful caregivers. Your courage during the pandemic has been inspiring, and now your resiliency as we recover is remarkable. I know volumes have been especially high in March and April as patients have been returning for long-awaited care. Please know that your fortitude is valued and appreciated by leadership, and most importantly, by our patients. You are making a true difference. So while we still have a journey ahead before we return to our fully normal lives, I know in my heart that we will reach our destination stronger, kinder, and more connected as a ministry than ever before. Many blessings to each one of you.